So from an update standpoint, at Chicago Arthritis and Regenerative Medicine, we have a lot going on. Even though our sort of clinical patient volume is down because of COVID-19 right now, I would say we're probably busier actually because of all of the administrative client service issues that we're still handling and dealing with in order to make sure that our patients are being appropriately cared for. Which is interesting because you can still do a great job even during these kind of difficult times if you have the right focus, which is a team that is really focused on offering high-level care, high-level service, regardless of what the scenario and the circumstances are, and regardless of the technical solutions that are available. And I'm really proud of my team for figuring out a lot of the back office stuff, which is very hard. But so some interesting things that we've kind of incorporated in this last week. So, one thing, a really interesting question is, as we start to get back into some version of normal life, how do we start testing people to see if they're safe to come back to the office, to work, all that kind of stuff? And we have some guidelines from the city, from the state rather, and we also have some of our own internal guidelines that just make good medical sense. So from the state standpoint, there are some obvious medical things like, hey, have the proper protective equipment on, make sure you're proper distancing between people, still try to maintain some degree of low-level traffic within the office as well. We're doing all those things, of course. We're trying to do most of our patient care via this kind of method, mainly because I think we can still do a great job of helping patients with their current or active or chronic issues in just this kind of method. And then the other thing is, just by having less foot traffic in the office, it's a safer environment for patients that do have to come in. And in that regard, when it comes to procedures or infusions, that lower level of foot traffic is keeping those patients safe. In addition, per state guidelines, we, for any sort of procedure patients, for any of our platelet, bone marrow stem cell treatment patients, we do need to check some additional COVID-19 antibody or COVID-19 testing. So specifically, the recommendation is nasal swab testing, and so we're complying with that. So the interesting thing is what tests are appropriate, effective, how reliable are they? And we've spent a lot of time thinking this through, going through what's available, and we have some internal guidelines about how we're trying to handle things. For example, for my own team, we are checking weekly antibody testing for all of us, and I'll explain why in a moment. We're also checking daily temperatures, daily symptom checks, all those kind of basic things. The nature of testing is that there is no test when it comes to medicine that is 100% foolproof. There's always some false negatives, some false positives, and as long as you understand the circumstances where that can happen and the reason why you're checking the testing, you can still make some smart, intelligent decisions based on what those results are. So in that regard, with the antibody testing, there are risks of false negatives. By checking everyone in the office, our team weekly will reduce that risk. There's also a risk of false positives, and we actually have a plan for how to handle that as well. But by checking antibody testing weekly on the team at work, where each one of us is individually considered low risk because none of us really have any significant medical issues, our hope is that if any of us develop anything, we have a plan where we can appropriately take care of that in an early stage by that kind of testing, so that we're not only protecting those of us that work in the clinic, but the rest of you, patients, and everyone else as well. And I think that's important. We actually have internal guidelines, and I meet with my practice administrator, Davey, and I meet with my physician assistant, Leah. We're meeting on a weekly basis to kind of revamp those so that as more information comes out, as more updated testing comes out, we are at that leading edge of making sure that we're protecting everyone. So that's what we're doing from a protection standpoint. We're not rolling out antibody testing. We're not rolling antibody testing significantly to patients because we're still trying to figure out how best to use that. There's some reliability issues with there. Eventually, we're going to figure that out and try to take care of things properly. So that's sort of our biggest updates right now in terms of how we're handling things. The other things are we are continuing to help patients if they need to be in the office, whether that's infusions or select procedures. We're still able to do that in a safe, compliant way that's medically appropriate, safe for all of you as well, and also meets all the guidelines from a regulatory standpoint as well.